Culver. She is a pediatrician. She's also she's vegan. Oh, I have to tell you about what happened last Friday. I'm sitting here, and a guy comes into the radio station who I was not expecting, and he's from PETA, which is about animals, and he had a box truck out front that looked like it had a wrap on it, and it looked like pigs were there. And he had been at Arby's actually at 6th and 31, and then the Arby's here in Plymouth over the lunch hours.
Yeah.
And they go there and they turn on the speakers and they have like squealing pig noises.
Oh,
and they're trying to encourage people to go vegan because of the way animals are treated for our food.
Right.
It's not always very nice.
Very pretty. Yeah, and and I do agree with PETA's message. I do think shaming people sometimes is not always the best, the most effective method. Shame can be a very effective tool, but on a mass scale, probably, or I don't know, it can work or it cannot. It just depends.
I think they would be better off to go to a restaurant. They go to food festivals and all kinds of stuff.
They do. No, they're great.
But I would rather them come and say, "Here's a veggie burger, or just a little sample.
Do the
Here's
positive
a hot
thing.
dog.
Do a positive
Try
thing.
this,
Yes.
Right.
Instead of don't let the animals die like this. Try this food," and I think that would be better off.
More effective, yeah. Shame can be a powerful tool, but it is not always the most effective. And yes, I agree. Making food a positive experience is going to have a much better effect. I'll share a story with you. So we just hired a new office assistant, and we were all working. As y'all know, the clinic is at my house, and so I made lunch for us, and I made a quinoa tofu veggie stir fry, and she'd never had tofu before, and so I made lunch, and she served herself a bowl, a little skeptical, like, okay, I've never had tofu, and she tasted it, and she
see eyes wide open.
She dropped an F-bomb with how surprised she did.
It's amazing.
She was like, this was not what I expected. I did not expect this to taste this good, right? And of course, that's the cook's biggest compliment, right? Like, wow, I got an F-bomb out of it. So she really liked it. And so to me, like, that is a more effective way to change someone and encourage change than shaming them.
Right.
Shaming them. I mean, in our generation, right? That's what our parents, shame and fear, right? Those were the tools our parents used.
Shame. Those poor children, those starving children in Africa would eat all of this food on your plate. You have to sit here and eat this until it's gone.
Right,
and
exactly. So it can be very powerful, but nowadays it's a little less effective. So I do wish PETA would take that into account, but I do agree with their message, though.
So we're gonna change it up a little bit today. We're gonna talk about adult diseases in kids' bodies, and I don't know that people actually understand that. I don't know. It's not that our kids are maturing faster.
Well, they are.
But it's what's.
Well, they are.
Are they?
They are. I mean, I think
Their bodies.
Our children are going through puberty about 2 years earlier than they did 50 and 100 years ago, and the reason is because of the hormones in the dairy and in the meat, because cows lactate after they give birth to a calf. The calf gets taken away, goes into the veal industry, but to keep the cow lactating and to hyperlactate, because they're not just feeding a calf, now they're trying to get enough milk for a lot of people at a mass industrialized level. They are fed hormones, and so that's the way they get the cows to lactate, and so those hormones then get passed on to whoever consumes the milk or the cheese or the yogurt that the dairy came from. So yes, our children are going through puberty earlier. Yeah.
But people, I hear people tell me about their kids now, and they're like, their kids are tired all the time. And it's like, I can remember as a kid growing up in the 70s. I mean, I was riding my bicycle and I was playing outside all day. I mean, chomping at the bit. no, you can't go outside until it's 8:30, you
Yeah.
know, and waiting. And now kids, I don't know, are there things that people can do to help their children?
Yes, absolutely. And that is a very common question that I field almost on a daily basis from people interested in joining our practice, or even through social media. People will DM me like, my kid is tired all the time. Is this something you can help with? Should I check their hormones? And the approach to fatigue in a child has changed in the last decades, because when I was training about 20 years ago, a little over 20 years ago, when I was in medical school, all these problems like joint pain, fatigue, high blood pressure, high cholesterol, those were grown-up problems. Those were obesity, absolutely.
Yeah.
Those were grown-up problems. Those were adult problems. I was told as a pediatrician, you don't need to worry about this. You don't need to learn the American Heart Association standards for obesity management, for cholesterol management, for high blood pressure management. You don't need to learn any of that. Well, lo and behold, in the last decade or so, that has changed. And it is something I never imagined that I would be managing as a pediatrician. And you're right. Children are not little adults, and it's not that they're becoming adults at a younger age. That was our mantra when I was training: is children are not little adults, but their bodies are now experiencing adult diseases. They're still children, they're still children's bodies, but a lot of these diseases like metabolic syndrome, insulin resistance, obesity, elevated hemoglobin A1C, type 2 diabetes, cardiovascular risk, all those things that we were taught, no, those are adult diseases. As a pediatrician, you do not need to worry about learning how to manage this. It's now happening in our children. Times have changed, and they're affected by these diseases that really were unheard of or rare back when I was training 2 decades ago, to the point where now the governing body that dictates how pediatricians take care of children, the American Academy of Pediatrics, a very well-respected organization, now recommends that children should be screened for high cholesterol at 9 years old.
Oh my
9 years old. Yes. Just a few years ago, it was 11, and now they've even dropped it to 9 years old. They even recommend that children as young as 2 years old should be screened if they have a parent with a total cholesterol of greater than 240.
Wow, 2 years old.
Yeah, 2 years old. And this doesn't mean that that children have become little adults. What it means, it is, first of all, a total mindset change for pediatricians, because again, we were taught you don't need to worry about this, but we do. Now we do. But it is also a mindset change for parents and caregivers, and the way that as a team, as a parent doctor team, we approach children's health and wellness. We have to screen for these conditions that we were trained, hey, they're not a problem in children. And it's challenging for both, for everybody involved, for the parent, for the child, and the doctor, because the way you diagnose a lot of these is through blood work. That's the only way to know if they have insulin resistance, to get a hemoglobin A1C. That's the only way to know if they have high cholesterol and get their cholesterol and lipid profile. A metabolic panel to look at liver and the kidneys. So really, blood work is the way to get a lot of those conditions checked, and kids don't like to get their blood drawn, and parents
and we don't like to draw their blood.
Yes, and healthcare workers, especially like if they're not at a pediatric specific practice, they don't like to get that done, right? Because nobody likes to make a child cry. And parents, of course, don't want their child to be hurt. And as painful as it is, however, the information that we gather from the blood work can really make a significant impact.
Fortunately, from a lab perspective, we need less blood than we used to.
Yes.
So that's a fortunate thing. So the analyzers we use now in the labs just use a small amount of blood. So it's not like you'd have to take lots and lots and lots of blood from a child. So
right, and that's actually a really, really good point, because if you're not using a pediatric specific lab, the lab will automatically tell you, oh, you need this much blood to get all the tests done. But if you then call and say, hey, this is for a pediatric patient, they use different analyzers, and they'll tell you, oh, okay, you actually don't need that many tubes. You're okay with the number of tubes that you drew. So it is very important if there's a doctor, nurse listening, and they want to get started on evaluating children for all these conditions, that it actually needs less blood than if you're testing for an adult. But it's very important to keep very good communication with the lab. At my clinic at Culver Pediatric Center, we have a standard wellness panel that we offer all families, starting at around 9, 10, 11. And it's a complete blood count, which checks like their red cells, their white cells, the subclasses of white cells, and the platelets that help us clot. A comprehensive metabolic panel that we just talked about looks at liver, kidneys, that's their blood sugar, their salts, like their sodium and potassium, magnesium. It looks at their protein levels, hemoglobin A1C, which is a diagnostic tool for diabetes, and it classifies depending on the level, it classifies the patient as either non-diabetic, pre-diabetic, or diabetic. The lipid panel, that's the one that looks at cholesterol and triglycerides and all that. And then I am a big fan of checking for nutritional deficiencies, because if your iron is low, of course you're going to be tired. Of course you're going to not sleep well. There's very good scientific evidence that low iron, low ferritin leads to very restless sleep in adults and in children. So we check in iron, we check ferritin, B12, vitamin D, folate. All of those, if they are low, can affect a child's mental health, behavior, overall energy level. So we check all of that, and we offer these as part of the annual wellness for our older children, but also offer it to younger children when indicated. And we do this because children are suffering from these cardiometabolic illnesses that they didn't decades before. And now I do have some families that, if they're worried about something very specific, like very low energy or bruising or anything, that is very worrisome, it can expand the blood work. We can check a tick-borne panel. We can check a rheumatoid factor, ANA, which basically to rule out rheumatological or autoimmune diseases, lead levels. I check.
I check. Talking about lead levels.
Yes.
The health department does.
Levels. They'll do them for free. I think for sure kids under 5. I'm not sure.
But
they
even have the test. Then if you have your child has high levels, they can come into your home and test to figure out where that lead is coming from.
Yeah.
So everybody has heard about the lead-based paints. But I can tell you that the one that they did a few years ago, the grandpa was reloading gun shells, and that the shot that they put in that, all of that, he had a little setup and everything, and the child was involved in watching and being around that. And that's
dust.
how
the
child got it. And things that you don't realize. And so the health department has got equipment to come and test it. It doesn't cost you anything. So, even if you go to your other doctor and they determine that, then you can check in with the health department and try to figure out how am I supposed to fix this?
And I've done that. I've referred families, when it comes to if they have a high lead level, to the health department to then help them basically be the detectives and figure that out. And just big shout out to the health department and Sandy Dunphy and everybody there, because I just absolutely love that group. They're so awesome and do wonderful things in our community. And Barb, we were talking earlier about mono.
Sure.
So I check for infectious causes, if, again, things like chronic fatigue or abrupt changes in mental health or energy level. I'll check hormones like thyroid. I'll also check for infectious causes like mono, like Bartonella.
I was just asking if mono was still, because I don't hear anybody talking about it too much anymore, but I was just asking the doctor if mono was still in the area, and that's still a thing.
Yeah, it is very much still a thing. I check if they've had a previous strep infection. There's ways to check that too. So, and all this is happening because the landscape of children's health and wellness has changed, because the corporate food industry has weaseled its way into our schools.
Are you able to diagnose type 1 diabetes in children with early testing? Because, oftentimes type 1 diabetes
Yeah.
is seen in children a lot more often. I think
Right.
you diagnose it.
Right.
And most of the time that happens in the emergency room when the child, it's an
Yeah.
emergent issue. You don't
Yeah.
even realize
Right.
that the child has it until they get to the emergency room and we diagnose it there. Are you able to pick those up earlier because of this early testing?
Right. So if there's no like screening tool or universal screening tool for type 1 or
Except
type
for
2
the blood
diabetes,
sugar.
except for the blood sugar, right? There's no like a
Even
genetic
will
marker.
the A1C be elevated?
Oh
with
yeah,
that?
yeah,
Sure.
with both.
Okay.
Yeah. Hemoglobin A1C will be elevated regardless of the cause of the elevated blood sugar, whether it's type 2 or type 1. So now, if a family is worried, like, and so
have
we
a
don't,
history,
like
because
for
that's
example, because
typical.
we don't screen universally, but if a family's worried, for example, if the kid has, they're very thirsty, they're losing weight or gaining weight, they are, they're peeing a lot.
Yeah.
A lot of times their breath has a certain smell.
The fruity
Yeah,
smell.
the fruity smell, or their urine has a different smell. So if a family, my approach is, if you blink at me funny, I'm gonna test you for diabetes. Because it is you don't even have to draw blood.
anymore.
Yeah, very common. But initially, we don't even have to draw blood. We can have them pee in a cup.
Oh,
we,
wow.
we can just
So
have.
it's not invasive in that.
Yes,
So we
yes.
do-
Yeah, and most of the kids that we're checking can already pee in a cup,
Sure.
So we have them pee in a cup, and then we dip the urine, and then that tells us if there is
There's a lot
sugar.
of things you can tell by being in a
Yeah.
cup.
Oh yeah, infection. Yeah, a lot, and so.
Liver disease. and lots of
Yeah,
things,
because
metabolic
it gives
disease.
you, it gives, so it's a nice little screening tool. So, because again, nobody wants to poke a child
Right.
unnecessarily, right? We don't want to do that. So, if we can have them pee in a cup and dip the urine, and if the urine has sugar, then we can say, okay, now we need to do the blood work. And in the clinic, immediately we do have the finger stick so that we
Sure.
can get what their blood sugar is at that point. But the gold standard is to then actually draw venous blood, which our amazing nurse Becca will do, and then that will give us the full comprehensive metabolic panel and a more accurate blood sugar. But it will also, but then we can also get that hemoglobin A1C, and the hemoglobin A1C is wonderful because not only do you stratify patients as diabetic, non-diabetic, or pre-diabetic, but it gives you what the average blood sugar has been, an estimated average glucose for the last
over 90 days. Yes.
3 months. Yeah, absolutely.
So yeah, they could have eaten a whole bunch of sugary cereal
Yeah,
that morning
yeah.
before they went to the doctor
Yeah.
that could elevate it.
Or
but
big fasting,
that test,
and it would have been normal.
Yeah.
but,
Right,
Yeah.
yeah.
But it's a good test over time for
Yeah.
sure.
Right. So that finger stick that gives you that blood sugar at that point is a screening tool. It is a screening tool, but it is not diagnostic. To diagnose, you need the hemoglobin A1C, which means a venous blood draw. At least at our clinic, some places have their own machine. We don't. We send it out to our lab vendor. But never did I imagine as a pediatrician that I was going to be, really just like offering this to 9, 10, 11-year-olds, and it really, it's because just the food industry has just really weaseled its way into our schools, our childcare centers, our homes. And what's worse with these corporate food systems is that they've convinced us that their products are healthy, nutritious, and necessary. And I'm talking about like the cookies who they health wash their labeling. Oh, this is organic. Oh, this is whole grain. Oh, this is high protein. Oh, this is zero added sugars that mean nothing. They are just marketing ploys. Cereal companies, granola bar companies, the granola
They're
industry.
good at it, aren't they?
They're so good at it, and they label it with little plants and green and put it in the section.
make it look healthy.
Yes, it's all marketing, and they green and health wash their products to sell these unnecessary food products to us and our children, and really it's such a tragedy, and the result of all of that is that parents have been hoodwinked, the schools have been hoodwinked, and now the result is now we're screening these kids for diseases that 20 years ago when I was training, I was literally told you do not need to worry about managing cholesterol as a pediatrician.
Well, food and what you eat is very important,
Right.
but How does genetics play in this picture as well?
Yes, so it's all multifactorial. So absolutely what we put in our bodies has a huge impact, but other sources of inflammation can also cause elevated cholesterol, and because it can impact our cortisol levels. So for example, stress impact our cortisol levels, and so then that'll set a cascade that, for example, will increase our blood sugar. So it doesn't necessarily have to be just food intake, but also stress, and stress can come from different forms. Genetics also plays an important component. Specifically, for example, there's these proteins, lipoprotein A and B, that if those are genetically elevated, even if you have a great diet, your cholesterol will be elevated. I will tell you personally, I have genetically those elevated. And as I have gone through my own wellness journey, I've seen, and I don't take medication, for, again, I might be sharing a little too much here, but I don't take medication for my cholesterol. But the biggest change that I saw in my cholesterol level is when I went from being a vegan, but a vegan who still ate vegan chicken nuggets and the vegan, all that vegan junk food. But that was delicious, vegan cheeses. Right. And so ate all of that. So when I went from a processed food vegan to whole foods plant-based, my cholesterol dropped 30 points.
Wow.
That was when I converted. that was my born again evangelical experience
and
into whole foods
we get
plant-based.
kind of sucked into that because I have genetically inherited my dad's cholesterol.
Yeah.
So he had a nice low cholesterol. My mom's was always very high. Yeah. They ate in the same food. Mom cooked the same meal for all of us, but mom's cholesterol was high, dad's was low. So and mine was reasonable and low. Yeah. So I inherited that, but so it's just trying to eat healthy is just because of my cholesterol's not high, it's still important for me to still eat healthy.
Right, exactly. And genetics play a big component, but what we have on our plate is always going to make a bigger impact, because a lot of times, even with genetics, like for example, with me, with my when my doctor, because she couldn't believe that my cholesterol was as high as it was. She's like, but you eat so healthy, how? And so when she checked those lipoproteins and they were elevated, she said, okay, we can start you on Lipitor. And I said, no, because of course I'm veggies over pills, right? No, I'm not doing that.
No pills.
Yeah. But she told me two things. You need to focus less on cardio and start working on strength training and building muscle. So that was one. And then she said, you need to stop going from vegan to really get closer and closer and closer to the whole foods plant-based spectrum. And I said, okay, I can do that. And then that's what I did. And yeah, within maybe less than 6 months, 30-point drop in my cholesterol level, so it makes a difference.
We're seeing so many more younger people having colon cancer in their 40s now.
And I'm
wondering, is that the same? Mm-hmm. Is that because we're not eating good food?
Right. And so the biggest correlation there, besides genetics plays a big component in colon cancer, is that we have removed fiber from our nourishment, and that is from the processed foods. We've sacrificed fiber for protein, because again, the food industry has made us believe like, oh, you need protein, and yes, of course we need protein, but they're feeding us these foods that have protein. It's low quality protein and it's nutrient poor protein, but it doesn't have any other nutritional density and absolutely no fiber, whereas the whole intact foods do have fiber and protein. I have little handouts that I use for my patients where I basically have curated a list of foods that are high in fiber and high in protein, and so like I have a little list of, okay, try to eat an item from this row at every meal. Sure. And then on the other page it says, okay, try to eat an item from from each row every day. And then nice. Unlimited, these are unlimited, these only once a day. So to give people an idea, and that way they don't focus on, I can't eat dairy, I can't eat meat. I don't tell them that. Again, try not to shame people, right? I don't tell them don't eat meat, don't eat dairy. Instead I say add these, and then eventually these will take more and more room on your plate, and you're going to be eating less and less of the foods that don't have fiber. But colon cancer, it's all about fiber. Again, this might be TMI. I am at the age where I got my colonoscopy, and
And what age is that? What is a good age to start colonoscopies?
45.
45 now?
Yeah.
Yes.
Yeah, and it might be 40 if you have risks.
Sure.
Yeah. So yeah, it's young. I mean, there's this actor that died of
Right.
colon cancer, the Black Panther.
Yeah,
Yeah,
exactly.
so sad. Very, very sad. And he was young too. So when I got my colonoscopy last year, a couple years ago, the GI doctor said, you have one of the cleanest colons I've
Oh yeah, I bet. I
ever seen. And
Because of what I eat.
yeah, and I told him, well, I've been Whole Foods plant-based for about 6 months, and he said, so am I. And he goes, and most GI doctors and cardiologists, that's what they're doing now.
They've seen it.
That's
Because they
right
see
there.
it. Because they see it,
The
right?
testimony right there.
Right.
I'm wondering, you talk about Whole Foods,
Yeah.
and I've never been there, but I know there's a
Right.
Whole Food stores up in
Yeah.
South Bend.
Mhm.
So you live in Culver.
Mhm.
Can you get everything you need between Culver and Plymouth shopping to
Yeah.
eat, or do you have to go to South Bend to the Whole Food stores occasionally to get
I
items?
have not stepped foot in a Whole Food store
Okay.
in 5 years or more.
Wow.
Yeah,
Okay.
yeah, no, I get all my groceries from the farmer's market, the Culver farmer's market, especially during the summer.
Yep.
Right now they're great. The Culver farmer's market, and then I probably do 50-50 between Aldi's and Kroger.
Okay.
Yeah, and I actually prefer Aldi's because Kroger does have a lot of temptation for that vegan junk. They have a lot of options, which they didn't have like 5 years ago, and now they do,
Exactly.
which is great. But at the same time, it's also like, well, it's still vegan processed foods. But yeah, and so I like Aldi's because there's less options, which is a good thing. There's less temptation for that. It's
Good
cheaper
point.
too.
Yes, it is.
Yeah, it's cheaper. But yeah, I say I would go.
And they have a nice selection there, for sure.
Oh yeah, I would say I would go 50-50 between Aldi's and Kroger, and yeah, I can't even remember the last time I stepped into a Whole Foods.
So it's possible, Kathy, that we can still eat
Yeah.
healthy and not have to
Yeah.
travel too far to get it.
No,
My daughter-in-law will probably die if
Yeah.
she hears this, but
Yeah.
this last weekend we had Oliver, who's now 9 months,
Mm-hmm.
and his pediatrician has said that he can start eating off the table.
Yeah.
Which is shocking to me
Yeah.
already, but here we go. On Saturday, when she came to pick him up at the racetrack where he was with his dad and me and we were working, he ate McDonald's chicken nuggets.
Yeah.
And I'm like, oh, that's processed food,
Yeah.
which it didn't occur to me really until now, but
Yeah.
it's like,
Yeah.
okay, can you eat chicken? Can you make chicken nuggets
Uh-huh.
at home?
Yeah.
Cut up
You can make
meats and
anything
just
at
do
home
it
now.
at home
Yeah, you can make
versus
anything.
because he's getting
Yeah.
those chicken nuggets, just like you said, they're processed, so
Yeah.
they have other things. That's not just chicken in
No,
there.
It's not.
So
No.
we shouldn't be feeding an infant chicken nuggets and processed food.
Right. And sometimes when you're out and about, it is so hard, right?
Yeah.
It is so hard. And then especially when you're around other people and they're like, oh, hey, try this, So,
Right.
yeah. And so I really, when you're out and about and your kid is hungry and they see other people, especially at 9 months, they're interested. And it's interesting because yes, now we call it's a funny name. We call it baby-led weaning. We, instead of doing like the pureed foods, as pediatricians, we encourage families to just feed table foods, chopped up, of course,
Yes.
but
Processed
but just
There
table
used to
foods.
be all those jars, and then
Yeah.
then you, after
And then
the
junior-
jars,
and then
the
junior jars.
Yes,
Yeah.
Junior
and
foods.
so that's why I was like,
Yeah. You don't.
table food at 9 months
Yes,
already.
but that's again the baby food industry brainwashing us into thinking, oh my God, you have to feed your child these little pureed things, and which really you don't. Avocado is a
He loves
perfect.
avocado.
Avocado is the perfect first food for babies. Steamed veggies that have been mashed up, fruits that are chopped up, pasta,
Yeah.
but it's or rice that's chopped up. Like they're really
chopped and mashed, just just to make
unmatched,
it. Yeah,
right?
really.
Exactly. So there really is no reason. They're convenient, absolutely, they're convenient. But I tell my families like this that it's also marketing, and this brainwashing that these food industries have made us believe like, oh, your baby needs this baby food. Your baby need. It's like, no, they can eat what you eat. It's just you have to make sure that you chop it up. You know.
Yeah. And I will say that Brooke is she does a ton of cooking.
Yeah.
She got my son to eat Brussels sprouts.
Whoa, that's awesome.
And he actually does. He'll eat them with no complaints anymore. Yeah. So she's big into trying healthy foods. Yeah. But it's like you don't think about it. Okay, your kid goes to school and there's a chicken sandwich.
Right.
Guess what? That's processed meat. That's not that they didn't just get a bunch of chicken breasts and grill them up and throw them on there. That is processed meat in that chicken sandwich. Yeah. So, and
it is hard because I know when my kids were little. I'm an empty nester now. We're empty nesters now, but when my kids were little and you get home at 6 o'clock, sometimes even later, and you're just tired. And the last thing anybody wants to do is chop, 5 different vegetables. So I do, and I do extend my families the grace of understanding that. And that's why I work with them. And when I work with families, one of the things I ask is, okay, what is your schedule? Who does the cooking? Who does the grocery shopping? Who does the meal prepping? Realistically, how much time do you have to cook in the evenings? And I encourage, for example, batch cooking. That's kind of the Mexican way of doing. I remember growing up, my mom would make a big pot of mole, and we would eat that for the rest of the week or for a few days. Big pot of rice and beans, and that's what we ate for the rest of the week. And so we call it batch cooking is the way we've described it. But basically, you make a big pot of something, and then you can serve it, put it in the freezer, or dress it up with other things to bulk it up, and that way you don't do when you actually are in the evenings. You don't have to do a lot of food prep or cooking.
Okay.
Yeah.
So obviously, it comes a lot of this. Diseases in these kids are coming down to what they're eating is not being helpful.
Right.
So if people want to figure out, what they need to do or how to change their kids' lives, where do they get started?
Well, the first thing I recommend is to sign up for Camp Veggie. Registration is available on our website. If you go to our website, www.culverpediatrics.com, if you look at Mind, Body, Spirit events, Camp Veggie will be in there. We have 5 sessions for 3 different age groups. We have 2 preschooler sections, 2 5 to 11-year-olds, and 1 teen section. And Camp Veggie is great. Kids are going to have so much fun. They will learn about where food comes from, bond together with their families, enjoy a healthy snack. We have partnered, speaking of Sister Connie, we have partnered with the Poor Handmaids to hold Camp Veggie at the center at Donaldson. They have these amazing greenhouses, and we're going to be doing Camp Veggie there. So we're really, really excited. So please sign up for Camp Veggie. And then if you want a little more than learning about food preparation, then I recommend, if you're worried that, for example, your child has a cardiometabolic condition, then please visit our website, www.culverpediatrics.com. Sign up for a free group info session, and I can talk to them about joining our practice. They can also text our office, 574-544-2343, during business hours to inquire about joining our practice.
I got to ask about the obesity side of things. At what point, because I see kids and I'm like, whoa.
Yeah.
I was lucky. I mean, my kids were not obese. They were really active. Yeah. But at what point does a doctor look at a parent and say, okay, your child's way on the wrong end of the spectrum here, and we need to... You don't want to say put them on a diet. We need to change.
We don't say the D word. We don't say the D word at Color Peds. Right. Yeah, it's about lifestyle. So that is such an important question because we have to dance this dance and this balance between educating and empowering and being truthful, but at the same time not body shaming, and traumatizing a child. Now, I am in a very lucky situation as a concierge practice that I don't have to discuss this during the wellness visit with the parent and the child right there in front. What I will do is I will send a message to the parent either before, if I already know, like this is probably something we're gonna have to discuss, or after, let's say, they come in for their wellness and we do the weight and the height and the body mass and the body mass index clearly and visually that the child falls in the overweight or obese category and I'm concerned about them, then I don't say anything during the visit. Okay, I don't say anything during the visit. What I will do is then afterwards, I will send a message to the parent and say, look, I'm going to send you their growth charts. So I send the growth charts as part of the visit summary. And then I say, hey, let's schedule a time for us to talk about,
just you and me,
little Susie's growth charts and growth
good.
And about some ways that, when I was in corporate medicine, there was no way I could have done that. I did not have the freedom to do that,
Yes.
so I feel very fortunate and privileged that I have that freedom to not discuss this in front of the child because and really it is not about putting them on a diet per se, because the same recommendations I'm going to give that family are the same recommendations I'm going to give a child or a family whose child doesn't have obesity or overweight.
Sure.
The big difference is that helping the child or the family of the child who has obesity or overweight to change their lifestyle as a family.
Yeah. Exactly.
It has to be as a family because
you
telling
can't single that child out. You can't say this is your food and this is my food.
Right.
No.
You can't do that.
No, it's all about the family.
And so at what point, Oliver, my grandson, who's 9 months old, he is perfect. Height and weight.
50% or whatever that is.
He's not either, but he hangs out with some other people, some other littles, and they'll be like, you got, and my kids, my babies they were roly-poly, the big old fat legs and all that. At what age do you start to worry, like, okay, because somebody said to Brooke, wow, he's skinny. And it's like, he doesn't look skinny at all to me. He looks perfect.
So,
but,
why?
Where do you consider worrying then?
So around age 2 is when we
Okay.
start screening for BMI. But again, BMI is a screening tool, but around age 2 is when I start having that conversation, not of, you need to put your 2-year-old on a diet, but hey, let's find ways to add more fiber, add more fruits and veggies, add more legumes. Here's some recipes that you can work on. So that's around age 2, because the weight of a child under the age of 2, it's usually because of maternal nutrition. It's more of a sign of maternal nutrition than the nutritional status of the age of the child themselves. After age 2, that's when genetics start to come in, and that's where the child's nutritional status start to play a more important role than the mother's nutritional status. So around age 2 is when I start having those conversations. But it's interesting that you mentioned that they've been told, he's too skinny. But it's because our perception of what a healthy body type is has changed dramatically, because when you are used to seeing kids that are a little chunkier,
Yes.
then a child with a normal BMI looks skinny, even though they're not. They have a normal BMI, or they have a normal body habitus, they have normal body composition, but they look skinny because especially in the Midwest, we're so used to seeing people
babies,
be bigger. Yeah.
Now, do you ever have what we used to call milk babies?
Yeah.
Babies that drink too much milk that are anemic.
Oh gosh, yeah.
So is that? Is that still an issue? It's been a long time since I had babies on bottles.
No, absolutely. And in fact, it's funny because when I ask about milk intake, families that don't know us, so that are new to our practice, they think that we're asking because we want them to drink milk. And the reason I screen for milk intake is not because I want them to be drinking milk. It's because I want to make sure they're not drinking too much.
Right.
Because of the iron deficiency anemia. So I was a resident, so this is, when I was a resident, I had a child that came in for a wellness visit it was clearly on the obese, overweight part of the growth curve. The complaint that the mom had was he's eating matches. He just keeps eating matches.
Yes.
And I was like, okay. So I mentioned this. I was training, right? I was an intern. And I mentioned this to my faculty attending, my supervising doctor. And she said, you need to get an iron.
Hemoglobin.
Yeah, hemoglobin. And we did. And it was like 8.
Yes.
Like super
Right.
low.
Right.
And then she told me, you need to ask about milk intake. And I asked the mom, and the mom said, he takes a gallon of milk every 2 days by himself. And we were like, so this is a diet that was very high in protein, high in calories, but very low in fiber and
Right.
nutrients.
Right.
And so the first thing we said was, you need to stop.
Right.
That
We've
needs
seen
to
milk
stop.
babies in the emergency room like that
Yeah.
too. That their iron level or their hemoglobin is so really low
Because of
That-
milk,
because of milk
the
intake.
cow's milk, and so
And the
people
funny
don't
thing you said
realize
about
that.
eating the matches, when my hemoglobin was low because
Pica.
of blood loss more than anything, I craved cauliflower.
Yeah.
I couldn't
Oh,
get
funny.
I
Yeah.
could
That's
not-
good though.
I know, but I could not eat enough cauliflower, and I'd have to have a head of cauliflower in my refrigerator the whole time.
Yeah.
And then I finally, after the Red Cross kept denying me of donating blood, I
Yeah.
decided, well, maybe I was in the lab. Maybe I ought to check my blood glucose or my hemoglobin, and
Yeah.
it was like 7.
Yeah.
That's because I was, and I should have realized that because I
Yeah.
was craving
And-
broccoli and cauliflower.
No, that's good. Well, broccoli, those have a lot of iron. And people don't realize that because we've been brainwashed into thinking that,
but
meat is iron.
stopped-
But
I switched from broccoli to cauliflower because the green things got in my teeth all the time.
yeah,
I
yeah,
always
yeah.
had to take
No,
some of it.
your body, and so this pica,
It was craving.
But
and I
that's
should've-
good though, because some people with low iron crave the pica. They crave things
dirt.
like dirt, because that's how we used to get iron back in the old days, right? You'd have a carrot and you just dusted it off a little and then ate the carrot, and it was still dirty and it still had dirt in it, and you ate the dirt from the ground, and we were outside all the time. So iron, that was actually a way we used to get. So dirt was the way we used to get iron back in the old days, and so so people with low iron will crave dirt, matches, and metals. They'll like lick metals, and so this particular child was eating them, like literally eating matches, and so that was my first introduction of, wait a minute, why are these kids who drink a lot of milk having these adverse consequences when we've been taught milk is good for you, right? If milk was good for us, why?
Yes.
Then it shouldn't cause these, adverse consequences to happen, but it is, and it's because the dairy industry has brainwashed us.
Yeah.
Jeez.
I know. Yeah.
Dr. Noemi, it's always fun having you here.
Oh,
on
fun
the
to be
air.
here, yeah.
I love it. This is a picture of my grandson.
Oh, he's
My little
beautiful
sweetie.
and healthy. Beautiful and healthy. Oh my goodness. And and like opinions, sometimes you just need to smile and go, thank you. I'll check with his doctor and see. Yeah. Smile and nod. Smile and nod.
Well, we want to
So-
thank you for coming in.
Yeah.
Dr. Naomi is in with us once a month on the show, and it's always interesting to talk about different things that are going